County Durham and Darlington NHS Foundation Trust has worked with technology provider HealthCall to introduce a new at-home blood testing service for people on the blood-thinning drug warfarin. Other parts of the country are now adopting the same technology to improve patient care, including Newcastle upon Tyne Hospital's NHS Foundation Trust. This is their story.
Warfarin is one of the top 3 most dangerous drugs we administer in healthcare in the world. And part of the reason for that is that warfarin prevents clots forming by elongating the bleeding time. And warfarin therapy consumes a vast amount of time and resource and huge levels of inconvenience for patients. Why don't we try and make it a little bit easier and stop disrupting patients' lifestyle and frankly make the entire process much more efficient for the NHS.
The pandemic hit, things changed, GP surgeries closed, which meant that we couldn't always get into that venue to run wet clinics.
But the self-testing programme is a great opportunity for patients because it means that they can have the flexibility. So if they're working and they've got commitments, they can do their test for themselves in their own house at their own convenience.
So the patients do the testing at home. They get a phone call or an email on the morning, basically says, what's your INR? The patient will then enter the INR using either the telephone or the email. It asks them 3 safety questions, which is what we would have done in the clinic. We then dose the patient, taking into account all the factors.
It's a little handheld device that they keep at home in a little carry case.
So what they do is you get a little stick, the stick goes into the bottom of the machine, and it's a case of just pricking your finger, collecting the little finger prick of blood. Give it a couple of minutes and then the result comes up.
Just saw the benefits in testing remotely. It's actually quite an easy process to do yourself. Very simple, the equipment's really easy to use, but equally it's the time for me. I can test myself in under a couple of minutes, whereas when I was visiting a clinician, a 2-hour time out of your day, on often, quite often, not the day that suits you from a work perspective.
But in terms of the hospital, it means, in the case of our service, which consumes 400 patients, 400 less parking spaces, 400 less healthcare assistants making introductions, 400 less interactions in the outpatient department, and 400 happier patients. So it's a terrific win-win situation, which both saves us money, but also transforms the lives of our patients.
I feel more empowered about my own condition. Obviously, I've got my condition for life, and I feel in control of my condition rather than letting my condition control my life. That's what I feel is a big benefit to me.